So in this video we will discuss about another two anterior pituitary hormone. One is melanocyte stimulating hormone, that is MSH, and another is gonadotropic hormone. MSH is also known as melanocyte stimulating hormone, and its function is to stimulate melanin secretion in skin and hair. Next, today we will discuss about gonadotropic hormone. Gonadotropic hormone secreted from anterior pituitary lobe is FSH, that is follicle stimulating hormone, and LH, that is luteinizing hormone. So function of follicle stimulating hormone in female is that they help in development of ovarian follicle and secretion of estrogen, means they are responsible for ovarian steroidogenesis. And in male, FSH stimulate and regulate the spermatogenesis and conversion of testosterone to estrogen in Sertoli cells. Luteinizing hormone, that is LH, its function in female is again ovarian steroidogenesis, and it is responsible for ovulation. And in male, LH causes testosterone production of testosterone by Leydig cells. The preparation which are available for of FSH are urofolitropin and folitropin alpha and folitropin beta. Urofolitropin is obtained from urine of postmenopausal women, and folitropin alpha and folitropin beta are the recombinant form of FSH. And the preparation of LH is lutropin, it is a recombinant form of LH. Now, uses of FSH and LH. FSH and LH preparations are used to treat amenorrhea and infertility in female, as they are responsible for development of follicle and ovulation. They are also help to aid in vitro fertilization, where there is a need for the controlled ovarian hyperstimulation in assisted reproduction technology. They are also used to treat male hypogonadotropic hypogonadism, as they are responsible for spermatogenesis. Now, the FSH and LH secretion is under the control of hypothalamus. From hypothalamus, there is secretion of gonadotropin releasing hormone in pulsatile manner, and it will stimulate the gonadotrope cells in anterior pituitary to synthesize and release LH and FSH. So some GnRH analogs like agonist and antagonist both are used for stimulation of FSH and LH. If they are given in pulsatile manner, then they will lead the release of FSH and LH, and if they are given in continuous therapy, then initially they will increase the gonadotropin secretion, but later on stages there will be down regulation of these receptor and there will be decrease in the release of FSH and LH. So GnRH analogs which are available in market are leuprolide, neferlin, buzerelin, goserelin, and triptorelin. Naferelin is also present as a nasal spray. As we discussed that if they are given in pulsatile manner, then they will have positive feedback on anterior pituitary and they will cause release of FSH and LH, which is responsible for ovulation, and it is useful in the treatment of infertility and for the diagnosis of delayed puberty. And if these GnRH analogs are given as a continuous therapy, initially they will increase the gonadotropin secretion, but on later stages or after 2 weeks of therapy, there will be down regulation of GnRH receptor, which will lead to the decreased FSH and LH, which will suppress the ovulation and suppression of spermatogenesis. So in continuous therapy, GnRH analogs are used when there is need for controlled ovulation as to aid in vitro fertilization technology, for treatment of uterine fibroids, for central precocious puberty, for treatment of endometriosis, and for the treatment of breast cancer. Now there are also gonadotropin releasing hormone antagonists are also available. Examples are cetrorelix, ganirelix, abarelix, and dagarelix. These antagonists competitively block the GnRH receptor, which will inhibit the FSH and LH without the initial stimulation as in case of GnRH agonists. Use of GnRH antagonist is in for the treatment of prostate cancer in male, as they decrease the testosterone level, and to suppress LH surge during the controlled ovarian hyperstimulation in female.